Anybody not heard about the Future of Nursing campaign out there? If you haven't, raise your hand. This is your opportunity to learn about it. Good, perfect. So some of us have been talking about this for a couple of years, right? Since 2011, when the Institute of Medicine came out with the report. We've had conversations in various professional organizations and meetings throughout the state. And so one of the things that I want to start today with, and this is really for us to have discussion, it's not just for Chris and I to stand up here and tell you everything that's going on in Nevada and everything that's going on in our country, but really to have some discussion. So what I want to know is, if you've been talking about this for a few years, you've been hearing about this at conferences, what are you doing to bring it back to your organizations, to your work groups, to your hospitals, to your health centers? What are you doing today to spread the word about the Future of Nursing campaign? And I'll call on you if nobody talks. I know a lot of you in the audience, and I will call out your name. So tell me what you're doing. Jeff Stout.
So we're doing a couple things. We've required our nursing leaders to, at the director level, they must have a master's degree. I know that sounds a little crazy that some of you may already do that, but we didn't have that in our organization. And all of our managers are required to have a baccalaureate degree. And we're moving towards requiring supervisors to have a baccalaureate degree. Along with that, all of our leaders, when eligible, are required to be professionally certified. This is our opening slide in every shared governance meeting is the Institute for Medicine's recommendations for nurses. Additionally, we've expanded our scholarships that we give out. During Nurses Week, we gave out, Chris, help me out, 16 scholarships? 13, I apologize. 13 scholarships last year to continue on education for nursing. And we are also moved towards preferential hiring for baccalaureate nurses. Did I miss anything?
I think that covers it. What else? Yes?
So at UNLV, we're really putting a focus into our graduate programs and doing some revisions of the programs that will allow easier transition from the master's to the DNP or the master's to the PhD.
Awesome.
One thing.
Thank you. What else? Yes?
Now, in San Diego, and also I'm from Philadelphia, Pennsylvania, and I'm here because I have some colleagues, and I'm with National University. But what I'd like to bring up is that it's in Pennsylvania where we did the Pennsylvania Coalition for Advancement of Nursing Education. And with my colleagues there, we have, I believe, a very nice white paper on nurses moving on in their education. And I think that those two papers, those white papers, are on the web, 2011 and 2012. And we want to do more of that like other states have done. We also have our Action Coalition back in Pennsylvania, but now I'm in California and hopefully we more here too in Nevada. I want to thank you.
Excellent, thank you. Yes, Deborah Scott?
Well, I think you already all know this, but during the 2013 legislative session, the Board of Nursing worked very closely and supported the Nevada Advanced Practice Nursing Association and our dear friend Maggie Carlton, who is our favorite legislator, to pass 8170, which created full practice authority for advanced practice.
It's awesome work. Anything else? Anyone else out there want to share what they're doing? Yes, Margaret.
We have had both Spring Valley Hospital and Sutherland Hospital down here in the South in partnership with UNLV to have dedicated education units in our hospital. And I don't know if any of you have ever heard of that model, but it really provides the student a great learning environment, and it also helps develop the staff nurse on the unit to collaborate in the education of those brand new novice nurses.
Excellent. Thank you. So you can see there is a ton of work being done to move the recommendations of this campaign forward. We're going to talk more specifically today about some of the things that Nevada is doing as a state to drive this forward. The other thing that you're going to have a lot of excitement around today is that this session is interactive. So we're going to be posing questions to you all, and I know you all have a cell phone with you. We would want that to be in the vibrate position so that it doesn't ring while we're in here, but we're going to be posing these questions and we want you to answer them on your cell phone, and we'll be able to share kind of what the audience is doing, what the audience is answering to these questions. So the first question that we have for you, and the way that this works is that you are going to text your answer to 22333. All of your answers will be texted to 22333. This particular response will be preceded by 703658. So in one word, describe what the Future of Nursing campaign means to you. And you'll understand why we only want a one-word answer as we go forward here.
Excuse me, technical difficulties.
Wireless difficulties.
You turned it off and I can't read it.
We'll turn it back on.
I promise. It should be right there, right? I'm connected. God damn it. It worked when I...
Okay, so because we're flexible people,
There we go.
oh, here we go. I was just going to say shout them out and we would make it work, but we've got it here. So here we go. Prepared, growth, hope, excellent, empowerment, awesome. So the more people who are responding with a specific word, the bigger the word is in this Wordle. So you can see that a lot of people describe the Future of Nursing campaign as excellence, growth, exciting. So this is kind of fun, right? This is interactive. It's fun. Does everybody kind of get the hang of the texting thing? This was the practice. Evidently not.
Well, those of us over.
So again, the way that it works is you text that number, 703658, and your response to that question to 22333. You'll have more opportunities as we go. I'm sorry?
Twice you text to that and the other number?
You text to 22333. Text the message.
Okay, so everybody gets it? All right. So you'll have some more opportunity here to be interactive. So as we start this discussion about the Future of Nursing campaign, we need to acknowledge the challenges that our healthcare system is going through at the moment and is going to go through in the foreseeable future. So we know that we have an aging population. We know that we have millions more people that have access to insurance who are now accessing our system much sicker because of a lack of preventative care. We know that we have a huge primary care shortage, and particularly in a rural state like Nevada, that's very significant. We have skyrocketing costs that are going to not be sustainable as we continue into the future. And so this really requires a shift in our thinking about our current delivery system. When I went to school 15 years ago to get my bachelor's degree, some of you are laughing. I remember my faculty having conversations about how healthcare was going to be moving into the community and that we were going to be focusing on prevention and wellness rather than sick care. And 15 years ago, honestly, I thought these people are crazy. They have no idea what they're talking about, because all of healthcare in my worldview was in the hospital setting. Well, they weren't crazy. They were absolutely spot on. And this is going to be our future. We are going to have to be focused on prevention and wellness and not that acute care hospital setting that we are today. So it really, really requires a shift in our thinking. We have an opportunity to move to a very patient-centered model of healthcare delivery. So we're currently focused in a very provider-centric or hospital-centric or healthcare network-centric world, right? And when we shift that focus to the patient, we look at things like improved quality, lowered cost, removing the waste from our current delivery system, integrating like we've never done before across multiple different areas and departments, whether they're in the hospital setting or out. Having coordinated care at home and in the community, keeping people out of the very expensive acute care facilities that exist today, and really focused more on outcome than quantity. That's a total shift for us. What this means for providers is that we're moving from a fee-for-service system to, which is really reinforcing that kind of siloed care delivery, right? To a model of shared payment, to bundled payments where everybody on the team is accountable for the outcomes. And so what that means is that we have a huge opportunity for the largest segment of our healthcare workforce to step up to the plate and be part of leading this change. The campaign vision is that everyone in America can live a healthier life supported by a system where nurses are essential partners in providing care and promoting health. We've known for decades that nurses were vital to the transformation of healthcare. And this is our opportunity to do something about it. So at this juncture, we really have two choices. We can let some other profession, some other department, some other agency, some other group of people tell us how this should be done, and we can blindly follow them off the cliff. Or we can step up to the plate and we can lead this change. We can drive this change forward. We are the largest segment of the healthcare workforce. So if we're not going to do this, who is? We are also the people most connected to the patients. And so we have to do this. So the Institute of Medicine report, 2011, one of the most read IOM reports in history. This is really the roadmap for the future of nursing. This is the document that laid out the recommendations that we're going to talk about today. This is the report that at the center said high-quality, patient-centered healthcare for all will require a transformation of the healthcare delivery system, and that's really what we're talking about. So the areas of focus of the campaign that we're going to be talking more about today are these. Leadership is really about what Dr. Tony referred to as nurses getting at the table. And Joey, our guest speaker, is going to be talking further about how we can do this. What strategies can we employ to get this done? But it's really about getting nurses in those decision-making roles, because that's where we can help influence change. That's where we can help drive this forward. Practice and care. This is about removing the barriers that prevent healthcare providers from practicing to the full extent of their licensure. And one of the ways that we've done that was mentioned by Deborah Scott, right, in Nevada. Education. This is not only about increasing the number of baccalaureate prepared nurses in our country, but also about ensuring that people continue to advance their degrees. So not only is it important to get a bachelor's degree, we need to have nurses going on to get master's degrees and then going on to get PhDs and DNPs, because those are the folks that are going to be teaching the future of our profession. And then interprofessional collaboration, which really crosses all of these recommendations. We know that nurses cannot do their work in silos. So we need to be working in those interprofessional collaborative teams in order to drive these recommendations forward. And then finally, as Deborah mentioned, diversity. So really making sure that our future healthcare workforce reflects our population and the communities that we serve. So we're going to talk first about practice and care. Here's your next opportunity to text in, how has Nevada, now we've given you a few hints here. We weren't intending to do all of that, but it's great. How has Nevada impacted the practice and care recommendation? So you're going to text first 704-802 and then your answer. So advanced degrees. This is very slow. This is one of those slow ticker tapes, right? So this is what we were really looking for. We passed AB 170, right? We're going to talk a little bit more about that, but that was huge for Nevada. And as I show you a map of our country, it's going to have more of an impact on you, I think. So when we remove barriers to practice and care, we think about the ways that nurses, and I think this is so important in a rural state like Nevada, can fill those shortages much more readily than some of our physician partners. So when we have huge primary care shortages out in rural Nevada, we know that nurse practitioners are more apt to fill those gaps than physicians are. And so that's really important for us. This is really about, like we talked about, nurses practicing to the full extent of their education and training and utilizing clinicians in the ways that their roles were intended to be utilized. This is the map of the United States. So you can see, thankfully, and thanks to a huge amount of work on the part of a lot of people, that we are green in Nevada, which means that we have full practice authority for APRNs. We are bordered by a huge state in California, right, that has attempted this work and not been successful to date. We are then bordered by other states in the green. And so this is really important for the west coast of our country, right? That we've been able to do this work. And this is something that comes up in every legislative session in many states. Everybody is trying to do this work because it's the right thing to do for our patients. We know that advanced practice nurses improve care on a wide range of indicators. So everything from patient experience to length of stay, blood pressure control, lipid control, glucose control. Certified midwives, the literature shows that patients that are cared for by certified nurse midwives have fewer C-sections and episiotomies. Preventative care is huge with our APRNs. We also know that we haven't been able to do this alone. So in January of 2013, both the American Hospital Association and the National Governors Association came out and really urged that all practitioners should be able to practice to the top of their licensure. So this is something that we've had to partner with multiple organizations to get done. So we talk next about the education recommendation. So what we want you to type in to 22333. Now these will be your answers. So if you type in 856712, that means your highest degree is an associate degree or diploma. And we'll see where we get in this audience. Got a lot of master's prepared nurses out there today. That's awesome. I'm impressed to see that 9 at the doctoral level. That's fantastic. What's the current statistic for doctorally prepared nurses throughout the country? I think the last time I read it was 6 or 7%. Less than 10. Okay, so this is awesome. So the focus on increasing the educational level of nurses is not, like I said, just about increasing the proportion of nurses with bachelor's and higher degrees. It's also looking at increasing the number of nurses with doctorates, because those, again, are the people who are going to be teaching the future of our profession. We need to have nurses prepared at that level in order to do that. The other thing that this recommendation focuses on is implementing nurse residency programs. And we're going to talk a little bit more about what we've done in Nevada. There's another statistic that currently only 6% of nurses who graduate with an associate's degree get an advanced degree, which enables them to teach, compared to 20% of bachelor's prepared nurses who pursue advanced degrees. So that's another reason why this is so important. We also know that studies show an association between higher nurse education level and improved healthcare outcomes. I'm going to read you a couple of studies. In October of 2012, a University of Pennsylvania study found that surgical patients in magnet hospitals had 14% lower odds of inpatient death within 30 days and 12% lower odds of failure to rescue compared with patients cared for in non-magnet hospitals. The study authors concluded that these better outcomes were attributed in large part to investments in highly qualified and educated nurses, including a higher proportion of baccalaureate-prepared nurses. You're likely all familiar with Linda Aiken's work that she first published in 2003, where she showed a strong link between RN education level and patient outcomes. They repeated this work in 2008 and found again that for every 10% increase in the proportion of bachelor's prepared nurses on the hospital staff was associated with a 4% decrease in death. So that's significant. We have at Renown Regional Medical Center, which is the larger of our acute care hospitals up in Reno, Nevada, 1,200 RNs. We have 49% of them prepared at the associate level and 51 at the baccalaureate level. So we have about 588 associates prepared nurses and 612 baccalaureate prepared nurses. If we increased that number of baccalaureate prepared nurses by only 62, that could result in a 4% decrease in the risk of death. So that's when it becomes really tangible, right? This is often a very difficult conversation. How many of you get a little bit uncomfortable when we start to talk about this? It's okay if you do. It's a little bit uncomfortable. But I think if we take all of the emotion out of this conversation and we think about the patient in the bed, we know the statistics. We think about that patient in the bed, and then we make that person in the bed the person that we care the most about in the world. We think about this in a totally different perspective. If it's your mom, your dad, your sister, your brother, your husband, your girlfriend, your boyfriend, your whomever, it makes a difference, right? If you knew these statistics and you had a choice, what would you choose? It's okay that you would choose to have a nurse prepared with a higher degree. And it is certainly not to say that having an associate's degree is not acceptable. But advancing on to get a bachelor's degree or a master's degree is what we're talking about here. We're not saying that every single nurse needs to come in prepared at the baccalaureate level. What we're saying and encouraging is you've got to have a plan. You've got to have a plan to increase your education. So we're going to have a little conversation about this right now. And I really want to know from you all, what are you doing in your hospitals, in your organizations, your departments? What are you doing to help us get to 80% by 2020, or get those master's prepared nurses, or help us prepare nurses at the doctoral level? What's happening out there? Yes, Margaret.
Preferential hiring of bachelor's prepared nurses.
So preferential hiring.
Tuition reimbursement to encourage those with associates to further their education.
Okay.
Partnerships with our universities
Okay.
to do that.
Okay, so tuition reimbursement, partnerships with the universities. What else? Yes.
DHS, we have our residency program, and our other programs throughout the facilities that we really push people to continue in school and get a better education.
Okay. What else? So, yes, Danielle.
I think really helping with the schedule so they have the opportunity to go back.
Yeah. So if we want people to go back to school, we have to give them the opportunity to do that, right? We have to be flexible in scheduling. That's absolutely imperative. Yes.
So what I would add is that you have mentoring programs as well.
Yes.
That they're formalized and they're in place and that you encourage that from the nurse managers. Also, it comes from the messaging from the nurse leaders.
Yep.
And the staff meetings, newsletters. Because they have to reach avenues, so there's a constant communication with the frontline staff to make sure that they understand that it's a priority.
Yep.
That it's an expectation.
Yeah, absolutely. So it's really that clear communication. And to Jeff Stout's point, really having the leadership team role model that. So if we don't have that expectation of our nurse leaders, it's really difficult to have that expectation of our staff, right? So you have to put a plan in place. And maybe it's a plan that's going to take 5 or 6 years to get to. But if you don't start that plan, you're never going to get there, right? Are any of you requiring a back to school for an associate's prepared nurse within a certain time frame? So that's something that's discussed out there. There are hospitals across the country that you can come in prepared at the associate's level, but you have 5 years or you have 10 years or whatever that number is to go back out and get your bachelor's degree. And you know that coming in, that if you elect not to follow through, that just means that you'll have to do something else and not continue your employment in that role. That's a pretty bold move, but that's something that we really have to think about to get this moving forward, right? Okay, and so diversity. So diversity is really interwoven throughout all of these recommendations. And Deborah mentioned that approximately 1/3 of our population is part of a racial or ethnic minority group, and this is from 2008. This data is from 2008, but only 18% of our nursing students were from a racial or ethnic minority group. We've got to think about that. So we need to be strategically figuring out what our population looks like in our communities and how we can encourage our nursing students, the future of our nursing profession, to look more like the community and that population. And it really isn't just about racial and ethnic minority. It is about gender. It's about your practice area. Having diversity among practice areas really promotes that diversity of thought, right? So if we only talk to white female nurses who work in labor and delivery about something, what perspective are we missing? We really have to think about that because it does promote that diversity of thought. This is some data that we pulled together for Nevada, and this is, I think, really fascinating. This came from the 2013 National Workforce Survey of Registered Nurses. This is Dr. John Packham's data, so he does a ton of work on the healthcare workforce in Nevada. So how many of you knew that 51 was the average age of a nurse in Nevada? If you've read the data, you do, but that's pretty astounding, right? 3.7% of our nurses are Hispanic, and 25 to 30% of our population is Hispanic. So we have a lot of work to do in this area. We have over 2 times more Asian nurses than the national comparison. Why is that? International recruitment. So several years ago, as we went through a huge nursing shortage in Nevada, we did a ton of international recruiting of nurses, particularly many nurses from the Philippines, and so that helps that number. The biggest specialty area disparity between Nevada and the United States is geriatrics, where Nevada has 1.9% of nurses describing their practice area as geriatrics. compared to 5.9% throughout the United States. And then we're lucky here, and Deborah alluded to this, that we have 8.4% male nurses compared to 6.6 nationally. So that's really pretty progressive. Interprofessional collaboration is another one of the recommendations that's really woven throughout the rest of the recommendations, and we talked about this being a focus. We know that nurses can't do this in a silo. We need to be part of an interdisciplinary team, and I would say we need to be the leader of that interdisciplinary team. So we're not the blind follower going off the cliff with that team. We are leading that interdisciplinary team, whatever the focus might be. And now I'm going to turn it over to Chris Gillen to talk about why we're here today, our nursing leadership recommendation.